Hi, this video is just going to give some real basic information about the G-tube and the Mickey button and what it looks like, the different parts to it, and how it works. So my daughter Emma has a G-tube for her type of feeding tube, meaning it goes directly into her stomach. There are lots of other different types of feeding tubes, so this is specific to a G-tube. The type of button that she uses is a Mickey button. The other type of button that I've heard of is the Mini One button. So that would be instead of this one, which is the Mickey button, it's the Mini One button. And it's very similar, the way it operates and everything. It's just a different type, it's a different shape, a different size, that type of thing. It's a lower profile, I do believe. So again, this is specific to what she uses, which is a Mickey button for her G-tube. So this is a brand new one that we haven't used. It's an old size that's too small for her now, so it's an extra one that we're just going to use for this example. So right on top is where you see the size of the Mickey button. So there's going to be two numbers. This one is 14 FR, which is 14 French, and that tells you the diameter of it. And then it's 2.0 centimeters, and that tells you the length of it. So for Emma, about every 12 to 18 months, kind of depending on how much she's growing, when we are at a visit with her GI doctor, one of the things that the nurse will do is she'll come in and she'll actually take out Emma's Mickey button from her belly and then use a special little tool that goes in to check the measurement to make sure that we're using the most appropriate size for her at the time. So we've had to size up a couple times over the years. It's not usually an urgent thing. Usually it's just, if you can tell when it's getting to be too short because it'll start to be real tight to her stomach where you can't really even fit anything underneath there. And that means it's time to size up to a new one. But again, they take care of that. They measure it and then give the recommendation on what size to change it to. The other thing you're going to see on here is on this port on the end, I don't know if you can see that, it says BAL, and that's for balloon. And that's where we're going to use the Luer Slip syringe to put water into the balloon to inflate it, and then also to pull the water out to deflate it. And then up on top, in that hole, is where we hook up the extension, which is what we use when we're doing a feed, giving meds, giving water through the G-tube, giving juice in my case since she's diabetic. And those things all go through the extension, which goes in to the top. So we'll go through that in a little bit, how you hook that up. So I know when we were in the hospital and first learning about how to care for a G-tube and what that even meant, what that looked like, it was hard to picture what exactly, was happening, what that looked like in her body. And I remember one of the nurses brought out what she called the G-tube baby, and it was a doll that actually had a Mickey button adapted to put into her belly, so you could actually see what that looks like, and you could kind of get your hands on it and feel what you need to do, and get a better idea of what that's like in your child's body. So again, this is just the top. It can open and close depending on when you're using it, and that just prevents little droplets from leaking out sometimes. So what I'm going to show you with this one is, this is what it looks like when it's brand new, straight out of the box, has never been inflated or used at all. So I'm going to draw up using this syringe that comes in the kit. This is the one that fits into the balloon port. I'm going to draw up 5 mLs of water. And then put that into the balloon port on the side. And then just slowly push that water in so that the balloon inflates. And after you've pushed all that water in, you need to keep pressure on the plunger of the syringe and then just kind of gently twist it and pull that syringe out. Because otherwise, if you let go of the plunger, it will draw that water back in. So this is an example of what it looks like, and this is what keeps it in place in her belly. So it gives some resistance. Now it can still get pulled out, because if enough force is applied, it's still going to be able to pull out of that stoma, the hole that's in her body. But it definitely, it's pretty secure. I'll give it a good little tug to make sure that it's secure, and it doesn't usually budge, beyond a little bit of a wiggle. So yeah, so this is what it looks like when it's in her body and it's inflated with the water to help stay in place. So then when you're hooking up a feed, this is what you're seeing on top of her skin, outside of her belly. So when it's time to do a feed, we open the port up, we put the extension in. So there's a little line on the extension, and there's also a little line on top of the Mickey button. So what you want to do is line those up, and then there's an arrow on the extension which says lock and shows you which way to turn it to lock it in. So we usually like to turn it 180 degrees so that that line is opposite from the other line. Then you can give it a tug to make sure that it's in there correctly, and it really shouldn't move at all. So on the extension sets, the ones that we use have two different ports, one on the side at an angle and then one straight up. And it doesn't really matter which one you use, but you want to put a cap on one of them and leave the other one open. And then this is your clamp, which obviously needs to be open when you are actively feeding or giving meds, and then when you're not, when you're between meds or stopping the feed, then you clamp it so that nothing can get through. So I'm just going to show you what it looks like. Pretend this is in her belly. This is the extension outside of her belly. I'm just going to drop a little water in a syringe, just 10 mLs of water in a syringe. She uses ENFit is the type of extension that we have, and these are the syringes that fit into it, and they screw right in like that, and then it's a secure fit like that. Okay, so what we would do then is after we hook it up like that, we would unclamp it, and I just want to show you what it looks like then. I'm going to push some water through and see how it comes out of the bottom right there, kind of in the middle of that balloon. So that's what happens when you give her a feed or medicine or water or anything through this extension. It goes through the extension, down into the Mickey button, and then goes into her stomach that way. So I think that just kind of helps to give a visual for what exactly is happening and how it works. I know that was helpful for me, like I said. Then the next thing I want to show you is then when it's time to disconnect her, to take that extension off, you need to turn the extension the opposite way from the lock arrow and make those two lines, the two dashes, line up again. So we're just going to twist it back this way, and you can see how they are lined up together, and then just pull it out. And you always want to make sure that extension is clamped before you remove it so that nothing leaks out of the extension. And then I always close the top of the Mickey button when we're done. Let's see, one other thing on this to show you is when you're trying to remove the Mickey button from her belly, when it's time to change it, or maybe you just want to check how much water is in it, you're going to use the same syringe that comes in that kit with the original Mickey button. Put it again in that BAL balloon port on the side, and then you would just slowly draw the water out. And you can see how the balloon shrinks back down, pretty much close to how it was initially brand new out of the box. And then again, when we're gonna remove the syringe, see if I just let go of the plunger, some of the water goes back in. So we're gonna pull back and then keep that pressure on the syringe plunger, and then just gently twist it out so that water stays in the syringe. And then again, if you're doing this because you're going to change your Mickey button, then this is what it's going to be looking like under her skin, in her belly, and then that's going to allow you to just gently remove it. Let's see, same idea if it were to get pulled out and you need to replace it. Only difference would be that generally, if it got pulled out, you know, because maybe it got stuck on something, somebody forgot to unhook the extension and then it got pulled on, or if your child pulls it out when they're playing, in their sleep, you know, whatever. So most likely there's going to still be some water in the balloon, maybe not all of it, but maybe some like this. And then when it gets pulled out, this is what you're going to find. So this happened to us last about a year and a half ago. We went in there to get her up in the morning out of bed, and I saw this laying in the bed. No idea how long it had come out. And the thing is, every person's body is different. So you don't know, there's no set guideline like, if it's been out more than 1 hour, then you're not going to be able to put it back in. Everyone's different, depends how quickly your body, tries to heal back around it, how long you've had it, all sorts of factors go into that. So we found it like this. And then what we did is, we took a syringe and pulled all the water back out, put some of the lubricant on that comes in the kits, and then we tried to put it back into her stoma like this, like you would, just during a normal Mickey button change, and we weren't able to get it back in. So we have a feeling that it had come out, several hours prior to that. So what that means then, when you can't, and then we tried a new one thinking maybe this one, still was inflated a little bit, and if we took a brand new Mickey button and put some lubricant on it, we'd be able to, maybe get it in there, but we still weren't able to. So we had to make a trip to the emergency department. And for Emma, this is kind of an extra big deal. It's a big deal for anyone because, if they're not able to get a button put in there to dilate it, right in the ER there, then it is a surgical procedure and they have to take you to the OR to do it. So it's a big deal for anyone. But for someone like Emma, it's a kind of an extra big deal because, besides medications that she's not able to get when she doesn't have this in her body, she's also diabetic, which means, and especially at that time, she wasn't eating any food by mouth. So that meant that if her blood sugars were to drop low at any time, we have no way of giving her apple juice or anything, formula, anything to try to get those sugars to come back up. So fortunately, since then, she does eat some food by mouth now. So we have that kind of in our back pocket as an option if this were to happen again. But when this happened, she wasn't eating anything by mouth. So it was an urgent situation. And fortunately, she has an insulin pump, so we were able to kind of suspend the insulin and, try to keep her blood sugars on the higher side just until we knew that this was back in and we had access to give her what she needed. So again, it's a big deal for anyone, but kind of an extra big deal for kiddos who have meds that they can't miss, or for someone like Emma that's diabetic and needs to have that access to give her juice or something in case of a hypoglycemic event. So I think that's the basics about this. If you have any questions, please reach out to me and let me know. Otherwise, I hope this was helpful. Thanks.